And to other stories, humanitarian groups are challenging the federal government to be more supportive of volunteer groups who work to bring medical care to citizens. The groups say a lot of children are in need of critical health support, which can be provided if government team up with humanitarian groups. Helen Osamede-Ekins reports.
The present economic conditions in the country have left more Nigerians struggling below or just above the poverty index. Beyond this, the lack of functional health insurance system that captures less than 5% of Nigerians' 200 million population means most citizens care for their health and those of their loved ones from out-of-pocket expenses, and for most of this is hard. Social and financial protection for poor and vulnerable population is a major development challenge across the globe, and this is where humanitarian organizations step in to provide assistance to both government and its citizens. According to National Library for Medicine, there are higher under 5 mortality risk for children whose mothers had cultural barriers and children whose mothers had resource-related barriers to health care. Aisha is a cancer survivor despite losing her legs in the process. She had to live with the disease for years due to lack of financial support. Like Aisha, Peculiar and these conjoined twins are alive today as a result of humanitarian assistance.
And they gave us a bill of like 22 million to cure the disease. We don't have it. We don't have it, so we have to come back to Nigeria. She'd been treated there. She came back, but for her legs, they said that there is nothing they can do.
So after they have always brought me, we have always taken her to hospital. Because when someone has police edema, you always have high PC. So your blood level is always high. In a month, I always go to the hospital for 2 times to remove blood from her body. Before they remove the blood, the blood will get very thick, black. And she has pica.
They were joined together. My mom would have said, how can I cope with this kind of children? Joining together. The only thing that God did was that they came with their hands, different hands, legs, different legs, and their manhood. But all of that thing joined together to the neck.
Governments at all levels are urged to support organizations who are in the business of supporting the needy to make life meaningful for them.
It's just partnership because the government too, they are overwhelmed. So every Nigerian needs to understand it is our responsibility to reach out to these kids who are in need. That's why we call it the everyday problem. Every Nigerian subscribe every month. What can you give? 1,000 naira by 1 million Nigerians. That's 1 billion naira. We can save lives.
Beneficiaries of this humanitarian assistance are expected to get treatment, surgeries and medicine for their health. Helen Osamede-Ekins, TVC News, Abuja.